Assalamu alaikum class. I hope you all are fine. This is the second lecture on the integrated management of neonatal and childhood illness. And in the previous lecture, I told you what is the integrated approach, what are the components of this approach, and what are the principles of this approach. And then we discussed about the outpatient management of children who come with the complaints of diarrhea or who come with the complaint of cough or difficulty in breathing, who are of the age group of 2 months up to 5 years of age. Now we are going to continue with the other complaints in this lecture. Now, the next complaint that a sick child of age group between 2 months to 5 years of age is fever. Now, the fever can be due to some minor infections or it can be due to some any life-threatening illness like especially malaria in some areas or meningitis or typhoid fever or measles. So all the sick children who come to the healthcare facility, they should be checked for fever. Now if a caretaker or a mother brings a child with fever, you have to decide whether that health facility or the area from where the child is coming is a high malaria risk area or a low malaria risk area, or there is no malaria risk present in that area. And after that you have to ask the mother that for how long the child has been having fever. If more than 7 days, then was the fever present daily and at any specific timings. And you also have to ask the mother that if the child has had any rash like measles, is that rash present now or had measles within the last 3 months. So these are the questions you should ask the mother when she brings a sick child to the clinical facility. Now after asking the questions, you have to make the clinical assessment. Now the body temperature of the sick child should be checked, and that child is said if the body temperature is above 37.5 degrees centigrade axillary or 38-degree centigrade rectal, that means that the child has fever. Now if that health facility has no thermometer, usually they do have, you can also feel how hot the body of the baby is. Now then after that now the clinical presenting then be assessed for number one, for the stiffness of neck. Now any stiff neck can be a sign of meningitis, it can be due to cerebral malaria or any other severe febrile disease. Now after that you have to look for the runny nose, look for any bacterial cause of fever, like look for any local tenderness or any oral sores, or if a child is unable to move a limb or any hot tender swelling on the body or red tender skin or boils on the body or the lower abdominal pain or pain on passing the urine in elder children. So you have to look for any bacterial cause which is causing the fever, and you have to look and feel for the signs of measles. Now in measles, you know, there is generalized rash and there can be cough, there can be runny nose or any redness of eyes. Now if the child has measles now, or you should also ask the mother that if there is no rash or if the child had measles within the last 3 months or not. Like if the child had measles 3 months back, there can be complications due to measles as well, which is causing the fever in that children. Now, after that, you are going to classify the fever of their child. Now, when classifying the fever in these children, as I told you before, that you have to keep in mind that the child is coming from a high or a low malaria risk area. Now, according to WHO, a high malaria risk setting is a situation in which more than 5% of the cases of febrile disease in children aged 2 to 59 months are malaria diseased. And a low malaria risk setting is a situation where less than 5% of cases of febrile disease in children who age from 2 to 59 months are malaria diseased. So these are the definitions of a high or a low malaria risk areas. Now, when classifying the fever, first we come to the high or the low malaria risk areas. Now, if there is high or low malaria risk areas and a child comes with the history of fever, you first have to look for the general danger signs or the stiffness of neck. Now, this usually falls into the pink zone. As you know, pink is the zone in which you have to urgently refer the child to the hospital, and this is marked as a very severe febrile disease. Now, in this condition, you have to give first dose of an appropriate antibiotic, and if there is a the child comes from a high malaria risk area, you have to give the first dose of an anti-malarial like quinine or artemether or artesunate, etc. And then you have to treat the child to prevent any low blood sugar, and you have to give the first dose of paracetamol and urgently refer the child to the hospital as the child has very severe febrile disease. Now, next is now the child does not have any danger signs or any stiff neck, but the malarial test comes positive. Now, this falls into the yellow section. Now, as you can see in the chart as well, this shows that the child has malaria. Now, if the child has only malaria, you give recommended first line oral anti-malaria to the child, give one dose of paracetamol in the clinic for high fever, give any appropriate antibiotic treatment if any other bacterial cause of fever is identified along with it, and you advise the mother when to return to the health facility immediately if there is deterioration of the condition of the child. And you have to also tell the mother to come for follow-up in 3 days if the fever persists or does not settle. Now, if the fever is present every day for more than 7 days, you have to refer that case to the hospital for further assessment. Now, next category is that the malarial test is negative and or there can be other cause of fever present, and this falls into the green zone. Now, in this slide, I told you that the green zone looks like a blue one. So, in this type of classification, the child only has fever and there is no malaria. So, you give simple paracetamol to the child. If there is any bacterial infection, you give appropriate antibiotic to the child. You counsel the mother when she should come to the hospital immediately and to come up for follow-up in 3 days if the fever persists. And if the fever is present every day for more than 7 days, then we have to further assess the child for any other cause. Now, these are the three conditions in which the sick child comes from a high or a low malaria risk area. Now, if the child comes with fever with no malaria risk, so in that condition, if there is any danger sign present or there is stiffness of neck, that is a very febrile disease, it falls into the pink zone. You have to give an appropriate antibiotic and you have to urgently refer that child to the hospital. And if the child does not show any stiff neck or any other danger sign, that falls into the green area, and this shows that the child has only fever. So you give paracetamol, you give any appropriate antibiotic if there is any bacterial cause of fever. Then you advise the mother when she should return to the health facility, and you also counsel her and you tell her when she should come for follow-up. Now, these were the conditions in which the child has fever and usually has malaria, or there is no malaria, or has any other bacterial infection. Now, if the child has measles, or had measles within the last 3 months of month, you have to look for, as I told you before, for the generalized rash, and you have to look for mouth ulcers or how extensive they are, or you have to look for any pus draining from the eyes, and you look for the clouding of the cornea. So if there is measles present at that time along with the fever, so that is a simple case of measles, and you have to treat with it. Now, if the measles is now or within the last 3 months of the sickness, you have to classify that if there is any danger sign or clouding of cornea or deep or extensive mouth ulcers, that falls into the pink zone, and this is a very severe complicated case of measles. Now, in this condition, you have to give vitamin A treatment immediately. Give first a dose of an appropriate antibiotic. If there is clouding of cornea, or if pus is draining out of from the eye, you have to apply the tetracycline eye ointment and urgently refer the child to the hospital. Now, if there is only pus draining from the eye, or there are mouth ulcers, this shows that the child has measles with eye or mouth complications. This falls into the yellow zone. So here you give vitamin A treatment. If pus is draining from the eye, you give tetracycline eye ointment. If there are mouth ulcers, you treat with gentian violet, and you counsel the mother to come for follow-up in another 3 days time. Now, if there is measles at that time when the child comes to the hospital, or there is no other complication present with it, so you just have to give paracetamol and give vitamin A treatment to the child, and counsel the mother that the child only has measles, and that is going to subside after some time. This is how you are going to manage a child who comes to the complaint of fever from 2 months to 5 years of age. Now, next we are going to discuss that a child comes to the health facility with some throat problem. Now, if a child comes with with some throat problem to the health facility, you have to ask about the soreness of the throat, and you have to ask the mother or the caretaker if the child is able to drink anything or is unable to drink, and also you have to ask that whether the child has fever or not. And after asking all these questions, or after taking the history, you have to make the clinical assessment. You have to examine the throat of the child. You have to examine the fever as well. Now, while examining the throat of the child, you have to see whether the tonsils are reddish or enlarged, or is there some abscess formation or exudate on the tonsils, or along with it there are some enlarged lymph nodes present. And as I told you before, you also have to assess the fever as well, and then you are going to classify the sore throat. Now, if the child has sore throat and is unable to drink. This shows, and the tonsils are, as I told you, are enlarged and red and exudated. So this shows that there is some throat abscess, and urgently you need to treat it as this thing falls into the pink section. And you have to get an appropriate antibiotic before the child is referred to the hospital, and you have to give some analgesic to prevent the fever and the pain. Now, second category is that the child comes with the fever and with or without sore throat, and with any of the two signs, like if they have exudate on the tonsils and the tonsils are red and enlarged, or if there are any lymph node enlarged. So that is a simple case of streptococcal sore throat. Now, in streptococcal sore throat, the appropriate antibiotic is benzathine, penicillin, or amoxicillin is given for 5 days, and you give paracetamol along with it for fever and for pain. And you have to counsel the mother that she has to come back if there is some emergency problem relating to this issue, and she has to come up for follow-up for after 5 days. Now, in the third type of classification of sore throat, there are no signs of any throat abscess or streptococcal. So this is a viral sore throat. In the viral sore throat, you just have to give remedies, and you have to counsel the mother that she just have to take care of the child. Just give paracetamol and give warm drinks, and just to relieve the pain and to give soothing remedies to the child. So this is how you are going to go about the management of the child who comes with the throat problem. Now the next is that the child comes with some ear problem. When the child comes with some ear problem, as you know, if it's not treated, it can lead to deafness as well. So when the child comes to the health facility with the ear problem, you have to ask the caretaker or the mother if there is ear pain, or is there any discharge coming out from the ear, and if there is a discharge, from how long this discharge is coming from the ear. And if you also have to ask if there is any the tenderness or around the ear. Now, after that, you are going to look for the any tender swelling behind the ear. You have to look for any pus which is draining from the ear, and then you have to classify the ear problem. By classifying the ear problem, if you see a tender swelling behind the ear, this is an emergency, and that child needs to be urgently referred to the hospital, as it falls into the pink zone and is diagnosed as having mastitis. Now, here you have to give immediately an appropriate antibiotic dose, and you have to give paracetamol to relieve the pain and refer the child urgently to the hospital. Now, in the second classification, if the pus is draining from the ear and discharge is reported for less than 14 days from the ear along with ear pain, that is labeled as acute ear infection, and it falls into the yellow section, as you can see in the slide. So here you have to give an antibiotic for 5 days, and you have to give paracetamol for the relief of pain, and you have to dry the ear by wicking, and you have to counsel and tell the mother that she has to come up for follow-up in 5 days. Now, in next type of classification, if the pus is draining from the ear and discharge is reporting for more than 14 days, that also falls into the yellow section, and this is a chronic ear infection. Chronic ear infection, you have to dry the ear by wicking. You have to treat with the help of a topical quinolone drops for 14 days, and you have to counsel the mother to come for follow-up in the next 5 days. Now, if there is no ear pain and no pus is draining from the ear, then this is a clear indication that there is no ear infection and requires no treatments treatments, and this falls into the green zone. As I told you in the previous slide, the green zone appears bluish in this slide as well. So I'm sorry about that, but this is a green zone. So this is how we are going to manage the child according to IMNCI guidelines if that child comes with a throat problem or any air problem. Now, next, we are going to do the management about a child who has come to the health facility for malnutrition. Now, while checking for the acute malnutrition, you have to look and feel for the signs of acute malnutrition. Number one, you have to look for any visible wasting. You have to look for edema of both the feet, and you have to determine the weight for height or length of the baby now or the child. Now, if when the height boards are not available in the outpatient setting, a weight for age indicator helps us to identify the child with the low or very low weight for age, who are at the increased risk of getting any sort of infection and poor growth and development. So you have to look for these things. Then you have to measure the mid upper arm circumference, which is in millimeters in a child of 6 months or older. Now, if the weight for height or length is less than -3 z-score, or the mid upper arm circumference is less than 115 millimeter, then you have to check for any other medical complication, like any other danger sign or any other severe classification, pneumonia with chest indrawing, etc. So you have to check for other things as well, and then you can classify the nutritional status. Now, when classifying the nutritional status, if you see that there is edema of both the feet and weight for height and length is less than a -3 z-score, or the mid-arm circumference is less than 115 millimeter, and or any one of the signs, like there can be any medical complication present or any problem with the breastfeeding. So if all these things are present, then this child falls into the pink zone, and in the pink zone it is diagnosed as having a complicated severe acute malnutrition. Now, in such cases, you have to urgently refer the child to the hospital, and before referring, you have to give a first dose of appropriate antibiotic, and you have to counsel the mother to keep the child warm and urgently refer that child to the hospital. Now, if the weight for height or length is less than -3 z score, or is between -3 to -2 z score, and the mid-arm circumference is less than 115 millimeter, and or it's 115 up to 125 millimeter, then this falls into the yellow zone, and this tells us there is an uncomplicated severe acute malnutrition or moderate acute malnutrition. In such a state, you have to give an appropriate oral antibiotic for 5 days, and you have to counsel the mother on how to feed the child, and you also have to assess for the possibility of any infection like tuberculosis, and you have to advise the mother when she has to return immediately to the hospital in case of any emergency, and if feeding problems, and you have to counsel the mother about the feeding recommendations, and you also have to counsel her that when she should bring that child back to the hospital. So this is about the uncomplicated cases. Now, when the weight for height or length is -2 z-score or more, and the mid-arm circumference is 125 millimeter or more, this falls into the green zone, and this shows that there is no acute malnutrition, and you just have to counsel the mother on feeding according to the feeding recommendations which are given by the WHO. Now, along with this, you have to check the child who has come brought to the health facility for anemia. Now, while checking the child for anemia, you have to look for pallor. Now, if there whether if there is severe pallor or if there is some palmar pallor, so then according to that you have to classify anemia. Now, if there is severe palmar pallor, this falls into the pink zone, and this indicates that there is severe anemia, and you urgently refer the child to the hospital for further evaluation and assessment. Now, if there is some pallor, palmar pallor, that is a simple case of anemia, and this falls into the yellow zone. Here you have to treat the child with oral iron. During treatment, the child should be seen every 2 weeks or follow up. It is advised after every 14 days, and iron treatment is given. If there is no response in pallor after 2 months of treatment, then the child should be referred to the hospital for further assessment. And iron is or not given to the children with severe malnutrition who are referred to the hospital. Now, while assessing the child for anemia, now in areas where there is evidence that there is hookworm, whipworm or ascariasis infestation, and they can also be main contributors to anemia and malnutrition. So regular deworming with mebendazole every 4 to 6 months is also recommended. So this is all about a case of simple anemia, which falls into the yellow zone. Now, if there is no palmar pallor, the child is diagnosed as having no anemia, it falls into the green zone. And if this child is less than 2 years old, you have to assess the feeding of the child, and you have to counsel the mother according to the feeding recommendations which are given by the WHO. And if there is any feeding problem, follow up is advised for after 5 days. Now, this is how you are going to check the malnutrition and anemia according to the WHO guidelines. Then after that, you have to check the immunization status of the child, and according to the EPI schedule, as I'm not going to go into the detail about it, and also about the vitamin A supplementation status. And you can give a prophylactic vitamin A single dose at 9 months with measles immunization if it's not has been done. And if the child has not been immunized before, you have to advise the mother that they should go for immunization and complete their immunization of the child or the baby who has come to the hospital. Now, then I've told you about the deworming status as well. I'm not going to repeat it like I told you. If there is hookworm or whipworm ascariasis infestation in that area, it contributes to anemia and malnutrition. So deworming status should also be checked, and mebendazole is recommended at every 4 to 6 months in these children.